across the world. Again, it's you know, we talk about it all the time. Knee replacement and hip replacement, the final report card doesn't come back until sometimes 15 and 20 years down the road. So while sometimes new technology is new and exciting, we're not sure how much benefit it's going to have for several years to come. Some of the things we know, it certainly does help maybe improve some of the alignment early on. What's that going to mean down the road, we don't know.
You can probably say without hesitation that in most cases that person is going to be more comfortable after knee replacement than before. Would you say in most cases the pain
definitely
is gone?
Yeah, that's why we do joint replacement. Yeah. Pain relief.
Pain relief, yep.
If you don't have pain, you don't need a joint replacement, and it's very predictable in getting rid of pain.
Recovery time. Now I know it depends also, we haven't talked about the less invasive procedures, minimally invasive. Are most people candidates for the minimally invasive procedures, the smaller incisions? What do you base that on?
Well, minimally invasive surgery, for the most part, whether you're talking about knee or hip, is mostly referring to the size of the skin incision. And when you see an orthopedic surgeon and talk about joint replacement, and you look at the parts that they're going to be putting in, you see pretty quickly that the surgery itself is very invasive. So whether the incision is that big or that big, what is done to the bone underneath the skin is the same. And what we have found in the last certainly 5 years, as minimally invasive surgery has been kicked around as a buzzword, is that patients' recovery is most dictated by how well we control their pain and how well we do the rehab.
So not necessarily the size of the incision.
No,
then.
If the incision's very small and the replacement parts are put in poorly, then the patient's not going to recover well. I think what we want to strive for is the incision being big enough to see exactly what we need to do without being bigger than it needs to be. And to Jeff's point, things like computer may make us be able to see without a larger incision. But the key is pain control, and some of the advances in anesthesia, the way we control pain, have probably been as big as anything in joint replacement in the last 10 years.
And what is, when it comes to pain management, we all know that a lot of people get in trouble after an injury or after surgery, getting on pain meds and having a terrible time getting off of them. What kind of pain medications do you most prescribe, and how do you sort of wean people off of them?
Go ahead.
Yeah, there's been a little bit of the whole pain management, and Craig mentioned this, there's been a shift in the paradigm or the thinking. Years ago it was a reactive, most patients just had a general anesthetic and then they woke up with the pain of surgery, and then you spent the next couple hours trying to catch up and take care of that pain. More and more now we're doing things, or the anesthesiologists are doing things like putting the leg to sleep, which also controls the pain for sometimes 24 hours or greater after surgery. So essentially have no pain. And we're also there's something called multimodal, or trying to control different elements. So we use anti-inflammatories to also help that element of the pain. So hopefully what we're trying to do is get away from using a lot of narcotics, but I don't think we're ever going to totally get away from it, because there is pain with the surgery. So I think the less narcotics that patients have, they seem to be more active during the day and able to do the rehab, and that's probably the number one thing. We like to see our patients up and moving after the surgery.
I was going to say, that's what you get them up, like how soon after you operate on them?
The day of surgery, we want them standing, and with knee patients moving their knee.
That day?
That day. The sooner the better. And to your point about getting off pain medicine, it's expectation. So if we can tell patients, at this point after surgery you should be doing this, at this point after surgery you should be doing this, and they see that it actually happens that way, then there isn't much of an issue saying, and at this point you really should not be needing a whole lot of pain medicine.
As far as rehabilitation, what kind of expectations should a patient have that's doing fairly well as far as rehab and how long they're going to have to be in rehabilitation, whether it's somebody coming to their home or they're going to a facility? I mean, is that maybe a month, 6 weeks after the procedure?
Most commonly it's 6
knee.
weeks of
That's 6
formal
weeks.
physical therapy after the procedure, and that's involved in A lot of our patients are able to go home after surgery and then go to an outpatient physical therapy center. And I think patients do pretty well with that. Now, occasionally they'll need some more help inside the home, or even have to go to a rehab center or a skilled nursing facility with physical therapy.
Okay. We need to take a break. When we come back, we're going to talk about we'll get into hip replacement, shoulder replacement, and this hip resurfacing, which I think you'll find interesting. And maybe there's certain things you shouldn't do after you have a joint replacement. We talked about the things you can do that you should be without pain and feel much better, but maybe are there any limitations after a procedure? And we'll take your calls right after this break.
The government Cash for Clunkers program is over, but Cash for Clunkers continues at Carnival Kia. And the best part is, Chase and Chandler are approving all the clunkers.
It's a clunker.
So if your vehicle did not qualify for the government program at another dealership, get to Hickory Hollow Carnival Kia or Carnival Kia Rivergate right now and receive up to $4,500 for your old car. And if you have a job and $149, I can sell you any new car on our lot. And remember, please don't you leave till you see me.
Do you know when a snore is more than just a snore? We do. St. Thomas Health Services Center for Sleep is Middle Tennessee's leader in diagnosing and treating sleep apnea. There are many types of sleep disorders, and left untreated, they can lead to serious problems. Call now to find out how we can help. St. Thomas Health Services Center for Sleep. Solving sleep problems is what we do.
Do you suffer from the symptoms of acid reflux, heartburn, irritable bowel syndrome, or ulcers? If you answered yes, you're not alone. Over 129 million Americans do. Would you like an affordable, drug-free approach to maintaining good stomach health and reducing the acid in your stomach? It's called AlloCure, the first certified organic aloe juice dietary supplement, fast becoming an effective, drug-free, and affordable way to naturally soothe your digestive system, balance your stomach acidity, and promote healthy digestion.
AlloCure is an all-natural solution that calms stomach acid and allows your body to heal itself. That's why I recommend it to my patients.
Call now and you'll receive 2 bottles of AlloCure, our informative booklet, Aloe Vera, a key to good health, plus the AlloCure gel. You pay just shipping and handling.
Call 1-800-767-1859. Order now.
I'd like to mention there is going to be a hip replacement seminar coming up at St. Thomas Hospital Tuesday, September 22nd from 6 until 8 in the evening. If you want more information, there is the website right there on the bottom of your screen, www.sjri.com. I also have a phone number. If you don't have a computer, you could call 342-0038, 342-0038. Again, a hip replacement seminar at St. Thomas, Tuesday, September 22nd, 6 to 8 in the evening. Sure, they'll have a lot of good information on hips. Okay, pain medication, I want to go back to that for a second. You made a comment during the break about instead of taking a lot of pain meds, that it's actually the opposite for a lot of people.
Yeah, joint replacement is definitely painful, but I think the misconception is that it's something people cannot tolerate. And we were talking, I think we're more surprised at how more patients say, I didn't need pain medicine as much as I thought I did. So that tells us that we're doing a very good job of controlling the pain without narcotics so that patients are not on them as long as they used to have to be on them.
That's great to hear. And for those of you contemplating, maybe you've been to the doctor and they're telling you really ought to consider the surgery, but you're afraid of that, I would think that'd be some welcome news. Let me go back to the phones. We have Carl on line 2 tonight. Good evening, Carl.
Hello.
Yes, go ahead.
Yes, I was wondering how often and how soon does the bushing in a knee replacement have to be replaced, or how long is it usually before it starts getting in trouble?
Okay, either one of you?
So again, talking about the plastic piece in between, and Carl, you're exactly right. It turns out that probably is the weakest link in the equation, and it is a piece of plastic, so it tends to wear out over time. Probably the most important thing that we can do at the time of surgery, again, is to make sure everything's balanced So those forces are equally distributed across that piece of plastic.